Hi, I'm John McDaniel. I'm the Chief Innovation and Digital Transformation Officer at Healthcare IT Leaders. I will be the host for this webcast today. What I'm really excited about is I just returned from Chime and had numerous conversations with several of my former CIO colleagues about some of the challenges they're facing today with modernization of IT. One of the key topics we discussed was really cloud modernization and moving IT solutions to the cloud as quickly as possible for a number of reasons that we will discuss in this session today. I'm pleased to be joined today on this panel with Pratima, who is the Global Head of AWS SI Health Services, Jeremy Marut, Founder and CEO of Sublimation Health, partner with Healthcare IT Leaders, and Brian McDonald, Senior Director, Sales Business Development for Healthcare and Life Sciences. Let's dive right in. The first question, Jeremy, to you is, what is the biggest issue or concerns facing healthcare IT leaders today?
Well, in terms of modernization, it's really about the unknown. It's a new technology in terms of cloud for healthcare, at least, even though the cloud's been around for many decades now. But really understanding what they're getting into, understand what the real total cost of ownership is, as well as the ROI and any costs in between. There are other anxieties around staffing and how to do it internally and how to bring their skills of their staff up to modern standards. The secret is it's not really rocket science, and there are real intelligent ways to go about it as long as you plan it out. So that's what we're hearing around the country, is really that anxiety that it's a big unknown for many.
One of the questions I hear quite often, this is back to Jeremy again, because I think it's very relevant, is what are some of the challenges you're seeing relative to the cost of migration to the cloud? I hear a lot of concern about it's way too expensive. I don't understand what it's going to cost me. Kind of what's your perspective on the overall cost of cloud migration?
I think a lot of it comes with the traditional hype cycle of anything. And it's funny. I love this industry. It's a challenge every day because you have multiple extremes in understanding and reaction. You have folks who don't really understand what the costs are going to be, but want to get into cloud very quickly. Then you have folks who have a bit of an understanding, but are going to do a dip your toe in approach and just do it piecemeal. Both have their disadvantages as well as advantages. But for us, we stress the planning as being the most critical. Planning at every step of the way, from really understanding why you're getting into it, what is the benefit of actually going to cloud, what does it mean to you to modernize.
Thanks, Jeremy. Pratima, I hear a lot of other challenges. From your perspective, what are some common misconceptions?
So from AWS perspective, when I talk to some of the CIOs of the hospitals and health systems, one of the biggest concerns is around the security. As most of us who've been working with healthcare organizations, we do know that, a lot of our services, especially on the AWS side, security and privacy is job zero. I personally feel it's our backbone. Specifically for the healthcare industry, we provide a number of global certifications, the HIPAA, HITRUST, GDPR, and others, so that we can allow our customers to store, process, and also transmit the most sensitive data in the cloud. So this will allow the customers to improve both their security and the compliance posture. For us at AWS, to be clear, I think most of them know we are very customer obsessed. But one of the things that we really do is we want to take care of the technology, the underlying innovation, so that our healthcare customers can take care of the patients that they're good at. The other misconception that I keep hearing, and this is definitely around the cost. We do have many programs to offset the cost, and we have tools like smart provisioning. We have tools like need-based elasticity. So basically, our customers, they can grow into the capacity using AWS versus do a guesswork and buy all the hardware upfront. The other part of the need-based elasticity allows our customers, especially if they're using a training environment, they don't have to run it over the weekends. They can shut it down on the evening hours. So that's something, an additional cost saving. Of course, around the EHRs, we are constantly listening to our customers. We're making some changes on our EC2 instance that can deliver the best response time.
Thanks, Pratima. And Brian, from your perspective, how do you see the healthcare industry benefiting from the advisory services that can be provided by healthcare IT leaders, Sublimation Health, Atos, and AWS?
Thanks, John. Great question. I think, by example, Atos and AWS work together for a particular healthcare IT organization, shutting down 139 of its 200 data centers globally, working to migrate this client to the cloud and the cloud journey. And so I think clients, when they hear stories like that, they want to, take advantage of an industrialized migration approach to AWS and take advantage of that important cloud platform to them and all the benefits that it provides. But the reality is that, you want to take that industrialized approach and all the things that, that we've learned across that. But it needs to be taken in consideration, put through the healthcare provider lens. And that's where, Jeremy and healthcare IT leaders, I think, provides an enormous value to clients to be able to help shape that, de-risk that journey. We know that, healthcare IT leaders, and Jeremy were the first to have migrated an Epic production environment onto AWS. Take advantage of that skill and expertise to get to to this terrific cloud platform, and then match that up with Atos, who has been a partner of AWS since 2013. About this time a year ago, for one full year now, we announced the strategic first of its kind partnership with AWS, where we're able to bring talent, expertise, and funding.
Pratima, I know from your perspective, and I'd like you to mention this a little bit, that as organizations start to look at this and have the fear of the cost part of it, I know AWS has some significant programs available to kind of ignite or get them started down the path of cloudification. And can you spend a couple minutes talking about that?
Sure. So one of the things that we're doing for partners, is working with Atos, Sublimation, and Healthcare IT is we have programs in place to offset the cost. Let's be honest, most of our health systems are under cost optimization, and the programs are developed so that we can help our customers on behalf of the cost optimization. So we have two programs in place. Some of you may have heard the migration assessment program called the MAP program. So through our partners, our customers will benefit up to 25% for any healthcare workload over 500K. And one of the nicest thing is it's not specific to any one of our healthcare workload. It could be in either EHR on AWS, Epic on AWS. It could be for your data lake or analytics. You could use it for your medical imaging workload. You could be using that discount program. Normally, we don't stack programs, but we have made an exception for Epic on AWS to provide an additional 25% through our partners, and it's called EHR on AWS. So this will allow our customers to get up to 50% discount for the migration aspects. And, we're always, like I mentioned earlier, we have tools, the need-based elasticity. So we do request our customers to do a TCO and let us show you the numbers through partners, and we'll be able to look into the cost and offset some of the biggest pressures that you are looking into today.
Thanks. And lastly, and I think it's always important to close with a success story. So Jeremy, if I could ask you to talk a little bit about the tremendous success you had with the institution in the northeastern part of the U.S., kind of what you started with, what you achieved, and where they are now would be awesome. Thank you.
Absolutely. We were very fortunate to be part of that world's first. do a lot of world's firsts, but this one in particular was the most groundbreaking. And it was pretty difficult for any health system, never mind to be the first, to convince a board to actually say, okay, we're all in. Because we had done a good 5 years worth of research to pick who the right partner is going to be, who's going to be able to address the entire ecosystem. Again, I can't stress that enough. But then you have to have an organization where the CEO is behind it, and almost more importantly, the board. So you got to walk in that boardroom and say, hey, we're taking everything out to the public cloud. And for years, it had been, you're insane, or a CEO could get fired for that. But kind of what Prathama brought up earlier about security and the cybersecurity insurance, that was certainly a helper. When they found out that we had signed on to be doing this with AWS, we actually were almost not going to be renewed for cyber insurance. And when the board saw the numbers, it was a panic, because we said, how are we going to survive without it? Because it was almost unaffordable. And then they found out about our project going into AWS, and not just the EHR, but the full ecosystem, production, non-production, everything soup to nuts. And what became 60 pages of cyber insurance documentation, we got a lot of check boxes automatically checked, because we were going into a $1 trillion company who was responsible for the overall security of the cloud. And in the cloud, that's another issue where most health systems, I'm sure, are not even aware that I guarantee you, when you look and you actually ask the questions, more than 40% of your applications running inside of your data center do not even have the capabilities to encrypt with TLS. So you have information maybe sitting at rest. All the storage now that's sold to healthcare is encrypted, but everything flying around your wires is completely unencrypted, 40% of it. And when you go out into the public cloud and you're starting from scratch and you're doing things modernized, you certainly don't want to be transmitting unencrypted information. So a reason that this is part of our success is, of the 42 that we went live with Epic, we were successful in getting about 38 of them, I think, with TLS incorporated into them that didn't have TLS capabilities for that encryption. And the remainder went into a little what I call principal's office that still continued to use VPN. But to go into that principal's office, we had to mutually agree that there'd be a roadmap for that TLS, because we don't want to waste our 100 gig pipes bringing them down all the way down to 1 gig. So in 14 short months, we did an entire brand new Epic implementation. A burgeoning health system was 3 independent hospitals, 3 independent IT departments, really coming together, just coming together. And this project was a digital transformation project, but it was a unifier in terms of technology. And we all had that focus that it's cloud or bust. There is no other option. So when we went live in 14 months, it was the entire Epic enterprise suite with everything, as well as 42 mission critical applications, but not just stood up there as some lifted and shifted app or normally operating app. It is completely surrounded by all the automations and financial operations and budget plans that are afforded to us by AWS, so that it's all automated. At 2 a.m, I have servers enough to serve 20 nurses when there's 200 or 2,000 in the middle of the day at 2 p.m. We are constantly on top of these budget plans, to the point of Epic itself. I don't want to get into the religious debate either, but in terms of purchasing hardware and running the application, we found it to be about 20% cheaper than having done it ourselves. But then when we got into the actual ecosystem, that's where you're seeing savings annually of upwards of 50%. Conservatively 20 to 30%, but there are some plans that you can apply on applications that are totally over-provisioned that bring those costs way down. Not to mention your non-production environments can be shut off at all times. You're not getting into operating system licensing agreements You're only using and paying for that OS when it's on. And we're automating all the updates and patching. So when it's off, our automations are going in there, turning them on, patching them, and shutting back off again. So you're not going to fall back into that technical debt. The real cool stat, the year from when we went live with Epic and this ecosystem, a year after we went live, we increased our usage in AWS by 40%. Yet our overall bill dropped by 20%. So in a consumption-based model, if you do a little math, this is an easy one for me, that's a 60% swing in efficiency and savings, as opposed to just doing it out of the box and the way the vendor asks you to do it. So in terms of time, in terms of building a team from scratch, it was Jeremy and Marut. That was the team when we started. Now the fully operational team hovers between 18 to 25 people, but all backgrounds of Citrix, VMware, Windows, Active Directory, not major specializations. I mean, they brought those specializations on over time. But in those 14 months, with just that few amount of people, we had the entire ecosystem out there. And from that day of go live to today, there are over 100 applications, what I call cloudified, all the automations and the financial operations. We've closed one of 3 data centers, and the other 2 data centers are on track to be closed in less than 18 months. So it was a tremendous project. We're very humbled that we had the fortunate opportunity to do it. I'm very glad that we had AWS as that foundational partner to do it, as well as the folks at Healthcare IT Leaders to really help us scale this up when we needed to, because you certainly don't need that level of scale of resources at all times, because there's real big boluses of work and then a lull, and then bigger bowls and then a lull. So it was a tremendous opportunity. Again, I'm very fortunate to have been through it, and it is what started Sublimation Health. So now I'm on a brand new journey after 25 years, and this is even more exciting than before. So thanks for having me today.
Thanks, Jerry. Congratulations to you and the Sublimation team for that significant event. And thank you all for really collaborating and talking about this partnership and what we bring to the industry that I think, quite frankly, from my 52 years of having been in the industry, has been lacking, and that's the collaboration with AWS, which has the solutioning on the cloud, with Jeremy and his team with providing those resources, and with the significant execution capability of Atos. As we start to build this out further and further, it's going to be refined and even be better than what we just described on this session. We know a number of organizations, again, are starting to think about this, and there's a couple of things that I think you can do that could start your process, could kickstart your process. AWS will also be providing funding to deploy a landing zone accelerator through that partnership. And again, Jeremy and Healthcare IT Leader teams will be providing that and support. I appreciate each of your time. Great session. I'm looking forward to continued success with the partnership. Thank you very much.